Good afternoon to everyone. Thank you for joining us for our Zoom meeting today, Wednesday, May 13th. Today's title is Preparing Your Business to Reopen After COVID-19 Coronavirus. On behalf of Risco Insurance, we want to just thank everybody for joining us. We are dedicated, as you know, to assisting our clients and our partners through this difficult time. We're very excited. A lot of things are happening. We're definitely going into uncharted waters today, and we're going to be talking about some essential mandates for every employer. Everybody sees the screen. One of the things that we're going to talk about is protecting your customers and the employees in the workplace, complying with Cal OSHA requirements for reopening, understanding employers' responsibility with COVID-19, and the Family First Response Corona Act. I'm going to ask everybody for a little housekeeping. If you could hit the mute button, we're trying to mute everybody, but if you can, sometimes Zoom isn't quite understanding our language. Yeah, cooperative. So if you can just mute yourself, that would be great. We'll have a time for Q&A at the end, but we're very excited to have everybody on board. I have Armando Diaz from Facility Management Group. Armando I've known for many years. He's not just one of our consultants, but he's a dear friend. He is a safety and consultant specialist, focusing in on especially a lot of the Cal OSHA regulations. So he's going to start off. And then later on the second half, we'll have Carmen Torres. Carmen has also not just a great consultant, but a wonderful friend from my HR specialist. So we're very excited. Get yourself a cup of coffee or some water, and we're going to get going. One of the first things I want to talk about is a disclaimer. You know, all the information contained in this meeting are subject to change. This meeting is designed to provide a general information on the subject matters covered. It is not intended to provide personalized advice or guidance. So again, you know, things are fluid, are changing rapidly. So California businesses to reopen, the guidelines phase 2. The Governor Newsom last week surprised everyone on Monday of last week, and he decided to roll out phase 2 that Friday. And what was interesting is that not until Thursday did he give everybody the details. And I'm just going to read from some of the transcripts. It says California counties could soon be allowed to reopen restaurants for inside dining and other later phase 2 businesses if they're able to meet the criteria laid out by the administration. Now, let me clarify this. Currently, it's retail, logistics, manufacturing are what has been unveiled. But within phase 2, this is what gets confusing. There are different stages. So you'll have a 1, 2, 3, I don't know what they're calling it. We call it A, B, or C. So within phase 2, there is a component for what many of those that are here listening to and eager to hear is restaurant dine-in. Now, we have to understand there's a protocol. So there's the federal guidelines, and then we have the state guidelines, and then you have every person has whatever county is, you have the county guidelines, and then you have the local municipality, your city. So they all have to be in line. So we want to make that clear. So I'm going to start off, we're going to have Armando, and he's going to start off with talking about protecting your customers and employees in the workplace and complying with Cal OSHA requirements for reopening. Armando, thank you so much for being with us. We're excited to have you. And the baton, picture a baton, guys. I'm handing it over to Armando. So Armando, take it away.
Good afternoon, everybody. And thank you for joining us. Sincerely, I thank you for joining us. This part of the presentation is focusing on 4 aspects of phase 2, the business reopening plan. So in this plan, there's focus on retail and manufacturing, and there is certain aspects that pertain to dine-in restaurants. Also, though, we'll be taking a look at the county responsibilities as part of the reopen plan, some really tough restrictions on employers as part of the reopen plan. And finally, the fourth aspect, a review of the plan itself. There are highlight points on training and screening that I want to take a look at with everybody and kind of expose you to what's going to be expected. Let's go to screen 4. The success of a business with this reopening is tied to the county health authority. There's 4 basic requirements. Okay, this is what the county needs to do in order to help us. Number 1, they need to show that they have the testing capacity. That's why it's so important in the governor's and the mayor's briefings every day that they show and they give statistics how many additional people compared to yesterday have been tested. Also, hospital capacity. There is a prediction, a possibility of an increase in infection. So hospitals are being required to create a plan for a surge, and there is a prediction of a potential 35% surge. Number 3, the ability to isolate people with the virus. And number 4, tracing ability. What that means is the county has to be able to prove that they have 15 people, they're called tracers, 15 tracers for every 10,000 residents. And the work of the tracer in the event that somebody is test positive, that individual will be assigned a tracer like a case. And that tracer will try to make contact with everybody who came in contact with the person who was infected. So the success of a business is tied into the county's ability to show the state that we are in line in these 4 areas. The next slide, it shows some overcrowding in hospital. This is a big fear as part of the reopening. You have pros and cons of the reopening. Some people are concerned that should this occur, what do we do in the event that there's more positive infections? Other people are more focused on the economy and how that's affecting us. Well, one thing's for sure, the businesses that are going to be allowed to reopen and they're being phased in, you definitely want to show proof to your city and your county inspector that you're taking spread prevention control measures. I want to show you the next slide, which leads us into the next slide, the county responsibility. The state of California has real high expectations. Part of the county's responsibility with the overall phasing plan, there's four different parts of it, phase 1 through 4. One of them is to show no death in the prior 2 weeks. I think all of us can agree at this time, that's a lofty expectation. I wish for it, I hope that it comes quickly. Number 2 is the county or the city, the county needs to show only 1 COVID case per 10,000 residents. Hospitals must have an action plan for potential 35% surge in patients, and also to include how to protect their workers. And number 4, having 15 contact tracers for every 10,000 residents. This is something I think is important for business to know, that we keep on top of our local representatives, not allowing them to fall back. Our success is tied into them, and these are 4 aspects of the phase plan that the county must meet. Now we get into the business aspect. There is a possibility of tougher restrictions imposed by your own city. In the city of Los Angeles, it's really, really strict, that's for sure. Some of these restrictions are no cash transactions. We're going to reach a point where the use of paper and coin will be obsolete. At this point, that's one of the goals, to just eliminate the cash transaction because of the potential for the virus to be spread through the paper, the handling of the paper. Also, though, break areas, employers that are phasing in, they need to make attempts to delineate the break area with a mark to show the safe space where people can actually sit in order to enjoy their break or their meal period. Also, too, though, the county is looking or not objecting to a company just simply closing down the break area. If you do so, then it would be necessary to inform your employees in writing that they must take their break in their vehicles. They must take their break somewhere else and maintain that physical distance. Another aspect of the phase-in with regard to employee responsibility is having sanitation material available throughout the facility, and also for any delivery type operations. If you have drivers who make deliveries for you, they need to have access to sanitation material in their vehicle. On the next slide, business response and spread prevention plan. Prior to reopening, employers must be able to prove they have a virus spread prevention plan in place. They have to train their employees as well. The training of the employees, I'll give you just a synopsis. They need to understand what are the routes of entry the virus uses to attack the body. They need to understand the signs and symptoms of, so that way they can identify within themselves if they're ill or if somebody else is. They need to understand what is the company's spread prevention technique and where are the sanitation stations located, what to do in the event that they feel ill, what is the reporting process. Employers are going to be responsible to screen employees and visitors. The screening process is interesting. I've already been exposed to it. In most cases, what's happening is the employer will have a monitor at the entrance, and they'll have the temperature monitor gun, and they point it to your head, your forehead. They're standing probably about maybe 4.5 feet away, depending on the length of their arm. They have to be fully dressed with face mask, and they take your temperature, and then they also have you answer some questions in writing. You put yes or no. Have I been exposed to anybody in the recent 2 weeks? Have I experienced any symptoms? Am I taking any medications? You put yes or no, then in the end you sign. That's part of the screening process. Point 4, the employer needs to designate areas that will be regularly disinfected. That'll be part of your spread prevention plan. For example, having a sanitation station located at the time clock, at the entrance of the building. We're still on 10. At the entrance of the building, and maybe even in the restroom, just for example. The last point is maintaining physical distance policy, and of course the markings, kind of like at the markets and at the stores, how they put markings on the ground. Employers must have this in order to start up. In this next slide, I wanted to review with everybody just some basic aspects of the business plan. For dine-in restaurant, which is really a big percentage of the overall market value for the state and here in the local community, the restaurants really want to get back up and running. Well, there's a few things that need to be in place. Number one, the written COVID prevention plan, having that. Posting the numbers of the county health department in a common area so everybody can see. Of course, the employee training. The next one is regular inspection. You want to have a documented inspection of your facility. At this time, it just states regular, so that can be interpreted a number of ways. I would suggest at least weekly and daily you're going through your facility so you can look at the conditions and make notes. Investigation of COVID-19 illnesses that are work-related, and then update your plan. Identify all employees who come within 6 feet of any infected person at work and isolate them. Also refer them to the doctor. When you perform training for your workers in preparation for the reopening, you want to inform them of the spread prevention techniques you have in place. You want to inform them of what pre-existing conditions, health conditions, present a risk, like diabetes and heart conditions. The employees need to understand what are the pre-existing conditions that present a risk. Also, to self-screening. It's being encouraged for workers to screen themselves at home, and then, of course, to follow the reporting process if they do have any signs or symptoms. Do not work if you have any symptoms or you're diagnosed positive for COVID-19, and go to your doctor. How to hand wash, at least 20 seconds, or you're using a sanitizer, 60% ethanol or 70% isopropyl. Number 6 is physical distancing, and item 7, wearing face covering. Do not touch eyes, nose, and mouth. These are aspects of page 5 of the dine-in handout that you have access to at the end of the show. On the next page 6, it talks about the screening process. This is important. You need to decide, how will you take the temperature of customers who want to enter your business? So again, the self-screening of employees, using gloves, especially for the screeners at the entrance, and face covering, making sure you're in compliance with the COVID-19 postings, the warnings, and now specifically for restaurants, servers, bussers, people that work in the kitchen, they must use gloves and wash their hands before and after removing the glove. The management needs to provide them with aprons, and dishwashers need to use goggles or a face shield and a rubber apron. Reusable personal protective equipment must be disinfected between use. So this is something not necessarily new, but it'll be enforced as part of the spread prevention. Apparently, the virus has the ability to survive on surfaces, and so the state's concerned with the possibility of the droplets of water from dirty dishes, for example, making contact with the dishwasher. There's a few other items on that same page, number 6 of the dine-in, that I wanted to point out. Cleaning high traffic areas and the vending machines, doorknobs, display cases, decorated fountains, and your computers, not cleaning, disinfecting. Not sharing devices or pens, establishing sanitary material in the dining area and the host area, the bar. You want to have a designated area. The potential for inspection is pretty high, having the county inspectors come in. So you want to have a designated area, meaning it's labeled. Consider also HEPA filters for your AC, your air conditioners. You'll be asked, what are you doing to improve the air quality? And it will be to your benefit to have a response. We've installed HEPA filter. Your menus, you want to consider creating digital menus or disposable menus. Reusable menu will be obsolete. You don't want to do, and if you do, you need to show proof that they're being disinfected after every use. Clearing the tables. You're not going to have preset tables anymore. The salt shakers and the soy sauce, the utensils, they'll all be removed. People will be escorted to their table, and it's clean. They don't get utensils and condiments until they are seated. And the condiments will be single serve, kind of like the McDonald's, a ketchup pack. It won't be a squeeze bottle that everybody passes around. Single serve. Utensils must be pre-rolled, so somebody who's disinfected their hands will have the responsibility of pre-rolling the utensils in a napkin and having it ready for the servers to take it to the table. Takeout containers, you don't finish your food, you want to take it home for later. They will not be filled by the restaurant server anymore. The customer will be given the box and they'll fill it themselves. Table linen must be removed after each use and placed in a sealed bag. You can't remove the linen and walk through the restaurant with it. And lastly, closing off any self-service areas like the soda dispenser and water dispenser or ice cream. That'll be closed off, no more self-serve. In the last part of the presentation, I just have some statistical data. It's changing daily. California's processed 4.2 million unemployment claims. This was as of last week, May the 10th, or as of Monday. Governor Newsom's advisors predict that the state unemployment rate will hit potential 18% this year. Nationwide, there's 33.5 million people applying for jobless benefits. And in LA County, as of May the 10th, there was 28,000 COVID-19 cases with 1,300 deaths. And statewide, 67,874 cases and 2,718 deaths. Phase 3 businesses. In closing, there's a short list of the businesses that will be included for phase 3. I know there's a lot of hair salons and the barber shops and the gyms. They're looking to reopen. Movie theaters and sporting events. The sporting events with no audience though. Religious services, including weddings. Phase 4, we go into concerts now and convention centers being open and sporting events with audience. That concludes my portion of the presentation. I really wanted to focus on what does the employers have to do in order for this to be successful, and in the event you have an inspection or employees who are aware of the rules and they start to ask questions, you'll be able to respond. Thank you very much, everybody.
Thank you, Armando. So just a question, as a clarification on the presentation, Armando, the link that we have here on the dine-in, that's a guide. So for those that are interested, just want to make a clarification. As he was going through the different processes, that's that slide that you see right there, that COVID-19.gov, the guidance for dine-in restaurants. That's what he was talking about and referring to. And then we also have another one for the checklist. So take a screenshot of that. And then at the end, there's one also that Carmen Torres will talk about. Thank you, Armando. A lot of good information there. What we're going to do is we're going to switch now. We're going to switch to Carmen Torres, my HR specialist. Once again, Carmen has done a great job in the past presentations, and we're going to go into now the second phase of Carmen's presentation, which would be understanding the employer's responsibility and COVID-19, the Family First Response Corona Act. So there's a lot of new pressure that's being placed upon employers. And this is why this session right now with Carmen is going to be so important. We're getting numerous calls, and that's what precipitated this session about workers potentially being exposed or testing positive. So Carmen, you're going to be that lighthouse in a stormy world. So if you can bring us into harbor and a safe harbor and kind of navigate through this whole area. Good to have you, Carmen.
Thank you, Javier. Thank you so much. Thank you to you, and thank you to Risco Insurance for inviting me to join you today.
Well, we're excited to hear from you. Again, a lot of things going on for employers. And like we said, these are guidelines. It's fluid. What I mean by fluid means that things are changing so quickly. And we're going to continue to have these sessions. Again, we're dedicated in trying to help our clients and our partners get through this area. And we just want to be a resource for them, as we've always been. And Carmen's been a great cornerstone to that. So Carmen, it's all yours.
All right, wonderful. Thank you very much. Good afternoon, everyone. And just like Javier mentioned in the beginning, I want to just echo on that a little bit. Just remember that there are so many changes happening. So before implementing any of the options that I'll be reviewing today, make sure to speak to an HR specialist, an attorney, or a safety specialist who can guide you and help you make the best decision for your business. And so we do know that, the COVID-19 pandemic continues to significantly impact the world economy. Since March 19th, there have been 40 million Californians that are under the governor's mandatory stay-at-home order. As Armando mentioned, and so did Javier, the reopening of some restaurants and retail stores and other places. We are in phase 2 of this pandemic. And you know, even though these dine-in restaurant services and other offices are not yet opened, you must be prepared for it. And that is one of the goals that we want to emphasize during this webinar. And then also, I mean, even after previously saying that malls should remain closed, the governor said on Tuesday that traditional malls and outlet malls and strip malls may reopen for curbside pickup service only. So as I mentioned, things are changing very, very rapidly. So I want to thank Armando, first of all, for the detailed information that he provided. And while he did go into quite a bit of detail, I'm going to touch just briefly. So you might see some things that are repeated in my presentation, and I'll just go right through them. But I did want to briefly touch on a couple of notes from that guide that Armando mentioned. And as you know, the governor's office did share that 12-page set of guidelines for restaurants, which spells out the protocols that they should be following before reopening for the dine-in service. And this document was actually provided or produced by CalOSHA, the California Department of Health or Public Health. So the document includes roughly 100 bullet points of criteria for restaurants. So that is a lot of information, right? I reviewed this guide, and I'll tell you, I think that while it is specifically for restaurants, I do believe that it's a good guide for you to reference for other business types. So I don't want you to think like, oh, well, it's only for restaurants, you know, it doesn't apply to me. No, you know what? Take a look, because it will give you some guidelines as to some of the things that you can actually be doing to prepare your business for reopening. So just be sure to follow up with your industry and city for the complete rules that are applicable to your business type. And so with that, you know, as Armando had mentioned with the prevention practices, the physical distancing is important, the face covering, the hand washing, and just be prepared to provide the protective equipment that's necessary to your team. Otherwise, you're not ready to reopen. So don't rush when the date comes through. Prepare yourself before so that you can minimize your risk of liability, which is what we want to do, right? One of the things that I recommend is prepare a one sheet for your employees. Let them know what is the best way for them to report an illness, and let them know how you will be responding to ensure everyone's safety. The more information you can provide to your employees, the better support you're offering and the less liability that you will have. So I know there's a lot of information to digest. You're not alone. You should definitely reach out to one of us or your attorney for guidance and support throughout each process, each step of the way. With that in mind, then I would like to mention that there are so many questions, like Javier was saying, around the Families First Response Coronavirus Act. And so let's go over them briefly. We'll take a little bit of time on this so that it gives you an opportunity to either take note. Do notice that, you know, my slides right now are going to be fully detailed because I wanted to make sure that you have access to the information that I'm going to be sharing with you. So this is officially known as the Families First Coronavirus Response Act. A lot of people are referring to it as the latest STIC and FMLA rules. And so let's just make sure that we understand what it is correctly. So this requires certain employers to provide employees with paid sick leave or expanded family and medical leave for specific reasons related to COVID-19. So the Department of Labor's Wage and Hour Division administers and enforces the new law's paid leave requirements. Keep in mind that these provisions will apply from the effective date, which I believe it was April 1st, if I'm not mistaken, through December 31 of this year. So obviously they are considering that employees may become ill later in the year as well. And generally, the Act provides that employees of covered employers are eligible for 2 weeks or up to 80 hours of paid sick leave when the employee is unable to work because the employee is quarantined, or is experiencing COVID-19 symptoms and seeking a medical diagnosis, or 2 weeks of paid sick leave at 2/3 the employee's regular rate of pay because the employee is unable to work because of a bona fide need to care for an individual subject to quarantine or to the care of a child. Typically, this child will be under the age of 18 years old, and or whose school or child care provider is closed or unavailable for reasons related to COVID-19, as well as up to an additional 10 weeks of paid expanded family and medical leave. So this would be at 2/3 the employee's regular rate of pay, where an employee who's been employed for at least 30 calendar days is unable to work due to a bona fide need for leave to care for a child whose school or child care provider is closed or unavailable for reasons related to COVID-19. So there may be some exceptions, with regards to the childcare of some students or children who are older or at least 14 years of age. In some cases, the parents are working and their student typically would go home after school, and so they didn't need any childcare. And then also, there's also a possibility that there could be another parent or an adult that is working from home who could care for the student. So we want to be very cautious when we are making these decisions, and we can go into a couple of details afterwards, but I want to make sure that I get all of this information to you and then provide you some examples of some of the things that work and won't work as it relates to who is eligible. So who are the covered employers, right? So it applies to employers with fewer than 500 employees, and that would probably be mostly everyone listening today. So this would be small businesses, but one thing to keep in mind, pardon me, is that small businesses with fewer than 50 employees may qualify for exemption from the requirement to provide the leave due to school closings or childcare unavailability if the leave would jeopardize the viability of the business as a going concern. So please consult with an attorney before denying benefits. So what this means is that if you are a business of 50 employees or less, then you might be able to deny that leave because, of course, imagine if you have 20 employees who are asking you for this leave because their children need to stay home. You might not be able to run your business as a result of that. So there may be some protection for you, but again, consult with a specialist to make sure that you are doing the right thing. And then eligible employees. Who is eligible? All employees of covered employers are eligible for the 2 weeks of paid sick time that is specified reasons related to COVID-19. So employees who are employed for at least 30 days are eligible. Up to an additional 10 weeks of the paid family leave. So this is the emergency paid family leave to care for the child. Now keep in mind that typically, if you are an employer with less than 50 employees, your employees do not normally qualify for FMLA, but this is not the FMLA we're referring to. This is the latest FMLA related to COVID-19, okay? And know that wherever there is a leave that is foreseeable, the employee should provide you as much notice as possible so that you can make arrangements for that. And after the first workday of the paid sick time, the employer, you may be able to require your employees to follow the reasonable notice procedures in order to continue receiving paid sick time. So again, you'll need to have proper documentation as well when you are paying out your employees in order for you to receive any tax credit under this leave. Okay, if you are not familiar with that, please let us know so that we can provide you further information on that. So what are the qualifying reasons for leave? Okay, so under the FFCRA, an employee qualifies for paid sick time if the employee is unable to work or unable to telework. This is very important due to one of the following 6 reasons. So let me mention briefly. Now, an employee who is able to telework, because there are some businesses who can allow employees to work from home, then they might not be covered under one of these plans if they're already staying home. Again, it's on a case-by-case basis. So let's not have a blanket, a policy about that. Let's consider this on a case-by-case basis. So let's go over the 6 reasons, the qualifying reasons for leave. So number 1 is that it is due to a need for leave because the employee is subject to a federal, state, or local quarantine or isolation order. So some counties, some cities, have these quarantine or stay-at-home orders. So if they live in a particular county that requires them to stay home, then they might be eligible for it. Number 2, they have been advised by a healthcare provider to self-quarantine. So, for example, someone may have experienced some, or perhaps they were exposed because their spouse or a family member has the COVID-19, and now the doctor has advised that this individual also quarantine for 14 days. So they would be eligible. Number 3 is that they are experiencing COVID-19 symptoms and they are seeking a medical diagnosis. Now, this is very, very important. I've been getting a lot of phone calls about number 3. What's happening is that employees are calling out from work because perhaps over the weekend, they spent some time with family and friends, whether it was at a park or at a family's home celebrating Mother's Day that just passed, right? And then 1 day later, 2 days later, they received a notice that one of the individuals there was exposed, and now they're concerned. So they're concerned and they're going to go get tested. This is a very probable situation and one that may potentially qualify the employee under this leave. So just because they don't have it yet, they still may qualify if they are waiting for results. And then number 5 is that they are caring for a child whose school or place of care is closed, or that the child care provider is unavailable. And it could be that perhaps the child care provider has COVID-19 or has been exposed to COVID-19. And then the 6th reason would be that they're experiencing any other substantially similar condition specified by the Secretary of Health and Human Services in consultation with the Secretaries of Labor and Treasury. So there are certain guidelines. If an employee tells you that they would like to take sick time under these guidelines, what you want to do is you want to ask them, do you have a medical diagnosis, or have you been requested by a medical provider to self-quarantine? Or if not, if it's related to the child, then you may ask them for information about the closure of that child care place, or the provider may provide a letter. Keep in mind that it may not always be possible for them to provide something immediately in writing, but it's best to err on the side of the employee. So give the benefit of the doubt to the employer. Remember, we are in California, and we want to make sure that we do things right, okay? So under the FFCRA, an employee qualifies again for extended family leave if the employee is caring for a child whose school or place of care is closed. Now, duration of time. This is very, very important, right? So for reasons 1 through 4 and 6, this is a lot of information, so you will have access to these slides. If you want to take notes, you're welcome to, but let me just go over these briefly. So a full-time employee is eligible for 80 hours of leave, and a part-time employee is eligible for the number of hours of leave that they would have worked on an average over that 2-week period. However, for reason 5, a full-time employee is eligible for up to 12 weeks and or 2 weeks of paid leave followed by up to 10 weeks of the paid expanded family and medical leave. So at 40 hours a week, and a part-time employee is eligible for leave for the number of hours, again, that they would have normally been scheduled to work over that period. If you have any questions about this, I'm happy to review it during the Q&A section as well. So calculation of pay, another very important piece, because a lot of companies believe that, well, I just have to pay them for 40 hours a week and, 10 days of sick pay. However, the calculation of pay varies depending on the reasons, and this is very important for you. For leave reasons 1, 2, or 3, employees taking leave are entitled to pay at their regular pay rate or the applicable minimum wage, whichever is higher, up to $511 per day or $5,110 over a 2-week period. For reasons 4 or 6, and you can reference the previous slide that you'll have access to so that you can match them up. But for reasons 4 or 6, employees taking leave are entitled to pay at 2/3 the regular rate or 2/3 the applicable minimum wage. Again, whichever is higher, but this is going to be up to $200 per day and $2,000 over a 2-week period. And then for reason 5, the employees taking leave are entitled to pay at 2/3 the regular rate or 2/3 the applicable minimum wage, again, whichever is higher, at $200 per day and $12,000 over a 12-week period. I know it's a lot of information. So, we're happy to answer any questions that you have. Now, how do you prepare when it comes to returning to work, right? So you want to make the necessary changes that have been recommended by CalOSHA and the California Department of Public Health. And again, some of those guidelines, you can find them in the PDF that we've mentioned a couple of times by providing the necessary training to your employees. And a change in status notice. This is going to be very important. You want to make sure that that notice has the rehire date, the position that they are coming back to, and the rate of pay. Because keep in mind that you may bring back your employees to work. However, you don't necessarily have to bring them back to the same position nor to the same rate of pay that they were at, as long as it's not below the minimum wage. I do have a client who is preparing to bring back some of their workers. This is a restaurant, and what's happening is that because they are having to limit the number of employees they're bringing back, they can no longer have specific titles to each of these workers. So what they're doing is that they're just calling them like front of office staff or front of house staff, back of house staff, administrative staff. And so be creative and consider that you may need to change the position titles for your workers so that it allows you to be able to utilize them where you most need them, okay? As well as the rate of pay. If you were previously paying somebody a premium rate because they were working the night shift or because they were a lead or a supervisor, then you may lower the rate to that to whatever rate is adequate and within reason to meet your current needs. And then you want to make sure that the personnel file of the employee contains the newest information that you are adding to it. In this case would be like the change in status notice. Be aware that I-9s are not required to be completed again if you are rehiring someone within 3 years. However, if there are any expired documents, definitely take a look at that. If an expired document such as a permit to work is no longer valid, then you may want to definitely replace that information because you still have to maintain the policies that you would have had COVID-19 not existed, okay? And then make sure to communicate what benefits the employees are going to be entitled to, whether it's vacation, medical, what happens to all of this information from them. And, this is going to be depending on the length of time, okay? And then the last item here is what happens when employees do not want to come to work. This is, unfortunately something that is happening. So the first thing that I urge you to do is address their safety concerns. Do they have the mask that they need, the gloves? Are you ensuring that they can work safely 6 feet away from each other? These are the kind of things that will help you avoid the claims to OSHA from your staff. Armando had a lot of critical information about this. And then consider, do they qualify under the sick rules or the emergency FMLA rules that I just mentioned? Is there a medical condition that you're aware of and perhaps they might be protected under? Another thing that some companies are doing is that they are allowing their employees to request time off or to use their vacation and PTO if they're just afraid to come back to work right now. These are things that you don't have to do this, but these are some ways that you can show some support to your employees. And then what happens to those employees who are a no-call and no-show? Well, again, follow your current handbook practices, review your current leave of absence practices, use your handbook as your guide, because no matter what, we are still required to follow the guidelines that are required by the state and federal to ensure the appropriateness of your employment practices. So your handbook is your best friend. Reach out to us, let us know how we can support you, and I would be happy to answer any questions as soon as that becomes available, or as soon as that opportunity becomes available. Thank you so much, Javier, and thank you to all of the participants.
Okay, thank you, Carmen. Wonderful presentation. A lot of stuff here. One of the things that a lot of people aren't aware, Carmen has a great website. The downloads, I think her screen. Okay, her screens. We changed her screen, but if you look on her screen on her website, she has some really nice downloads. What we wanted to do before we go into the Q&A, I wanted to go to that checklist that we at Armando had talked about, because I know there was a lot of questions there. So we're going to go into that checklist just so you can. We're going to glance through it. We're not going to go over it, and we just want to focus on page 5 and 6. By the way, all of this is being recorded right now, and you will have it on 5 and 6, and it will be on the Risco YouTube. So yes, Risco has a YouTube, and this will be placed on there tomorrow. So you can go back through the presentation again. But we just want to show you that this checklist that Armando was talking about in this guidelines, and they're all here, right there.
Well, 5 and 6.
Yeah, 5 and 6. So you'll be able to see. Just scroll through it. We want to give everybody an opportunity to look at it, and it's all there. The things that Armando talked about. So you can download that. And then there's a dine-in one. So real nice piece for everyone. Again, you can download it off our YouTube, or you could just get it. We're going to go to page 5 and 6. Right there, 5 and then 6. Those are the kind of key areas.
Control measures in the screen.
Yeah, the control measures in the screen. So anyway, we wanted just to make sure you have that. So now we want to switch over. We want to talk about there's some Q&A. So Carmen, there was some questions. So I'm going to have Saida. Thank you, Saida, for helping us put all this together. Saida, can you give us some of the questions that you had? So there was a couple questions. All right, so I'll read that question. Okay, so one of the questions for Carmen is this. What can an employer do if the employee refuses to report to work and prefers to collect unemployment? Employee has not given COVID as a reason to not return, stating that they prefer to collect because it's not worth part-time, returning to part-time, and asked to be paid cash if they return. So wow, that's a big question. So Carmen?
Absolutely, that is a fully loaded question. And first, let me say this. never, ever, ever do not pay your employees cash if they are requested to be paid cash. That is definitely not the way to, get out of this safely. So definitely avoid that. If an employee refuses to return to work, then what they are ultimately doing is that they are declining employment. And the reason why employees are currently qualifying for unemployment benefits is because there was no work at one point. But employees are also required to complete a weekly notice to EDD, letting them know whether or not they have applied for other work. Are they still looking for work? Did they decline work from anyone? And they're supposed to respond to that, appropriately. Now, there may be an opportunity where the employer can submit a report of the employees that they have requested and who have come back to work. And in that report, you may also include whatever employees refused to return to work. This is unfortunately a situation where, while it's unfair, perhaps, that they don't want to come back because they want to continue to receive the EDD benefits, and makes sense, right? If they might be making the same amount of money right now, specifically because of the additional $600 from the federal benefit, which is a reason why a lot of employees want to stay. But what's going to happen after July 31 is that benefit is no longer going to be available. And guess what? Neither is their job, because you have the right to hire someone else to replace them because they refuse to come back. Then what's going to happen is that you may receive a notice from EDD asking about, why they no longer qualify. And at that point is when you may be able to respond that they refused work back in mid-May. And the employee will likely be responsible for paying back some of that benefit.
Great. I have a question for Armando. One of the questions is, if one employee tests positive, do all employees need to get tested, Armando?
The answer to that question is the company investigator would be required to identify any other person or employee who came in contact within 6 feet of the person who tested positive. And all those people would be quarantined for a minimum of 14 days.
I have another question. ED benefit recipients are currently not required to report job search in order to expedite benefits. So I don't know if that's a question, but it looks like, or maybe it's a question. So do they have to, I guess maybe for Carmen, or do they have to be looking for a job right now, or do they have to do a search? Is that required right now?
So originally, what happened is that the governor did modify the EDD benefit requirements to expedite, their ability to receive benefits. However, as things have shifted, I am aware of certain individuals who are receiving benefits and who are having to verify. So it could be random, it could be changing. And even if they are not having to report job searches right now, they may have to report certain information specifically about whether or not their employer offered them their position back and whether or not they declined an offer of employment. So again, while as employers, it doesn't feel fair for us, however, that is something that the state of California will deal with individually with every benefit recipient.
Great, thank you. I have a question. I know you touched base on when businesses hire their employees back, but this one is in regards to what if they were rehired already? Can we still change their position and the pay rate?
That is a very good question. So It is possible to do that. I would encourage you to work with a specialist or an attorney to help guide you through that. It's going to take a few questions. Remember that I said, we have to look at things individually and on a per person basis. So while it is possible, we want to make sure that we avoid any claims of discrimination or just make sure that the employee understands why that change is being made. And I think that's going to be the most important piece is why is the change being made? If, we can work on that, then there's definitely a possibility of being able to change position titles as well as pay rate.
Okay, and then Carmen, so somebody has, they believe they've been exposed to the virus, but not sure. They get tested. They're asked to stay home between the time that they test. A couple questions. When do they need to get the test? Let's say it was on a Monday. They call and said, I feel that I was exposed. What's the time length? Do they need to actually get tested? Is it immediately? And then the second question is, in that interim, is there any benefits paid? And I guess let me couple it with if the test comes out negative, is the employer liable for that downtime?
Great question. So, obviously, if someone believes that they have been exposed, then, your sense of urgency is going to be critical in this. And so the recommendation is, yes, test right away, especially right now. There are so many testing centers that are available to all of us. And most of them are actually free of charge. In some cases, you may have to make an appointment, but there are a lot of drive-through services that are available. So the recommendation would be that as an employer, if someone tells you that they may have been exposed, then you may require them to be tested before they return to work. And typically the test the results have been, anywhere between literally same day to even, within 72 hours. And Armando, feel free to correct me if I'm wrong or if there's anything else that you'd like to add on that piece. However, it is important for the employee to be tested immediately. Now, if they were waiting for results, then it's very likely that they're going to qualify under these new sick pay rules. And that they could be paid for the period of time that they were waiting for their results. If the results come back negative, then in order for them to come back to work, they would have to be able to provide that notification to the employer so that the employer can bring them back to work. Now, if the employee results are positive, then again, you would provide that result information to the employer, and then the 14 days would begin, or the notice may actually tell us when those 14 days would complete. So in cases where the employee takes much longer and they're just putting it off and not testing, the employer may not be liable for that waiting period. The employee may need to use their regular sick pay that they would likely have accrued if they have any available, or to use a vacation or PTO for that time. Remember, right now it's much easier for employees to be able to provide that documentation, whereas in the beginning, the first few weeks, even the first 4 to 6 weeks, it was a little bit more difficult because the testing was not available immediately to everyone.
Carmen, would you say that under the Family First Response Coronavirus Act, that the item number 3 would be most applicable for this situation where the employee does not know what their diagnosis is, they're just ill, however, they do have some symptoms that are similar to the COVID-19, so they take time off to see the doctor, and during this time off, would Rule 3 of the Family First Response Coronavirus Act be applicable while they're seeking diagnosis?
Yes, correct. So it would definitely be applicable. And should they provide the information, that says if the information is that it's a negative response, then they can get paid through the law, as well as come back to work if their notice says not negative, or the doctor may recommend that this person actually remain at home and in quarantine the entire 14 days of a time, right? So the doctor will make that determination. So if the doctor says, or the medical provider says that they must be in quarantine for the 14 days, then it would be applicable and they would qualify for the benefit.
Great, great. Well, thank you so much, Armando and Carmen. Thank you for that wonderful presentation. I'm sure some employers are on the line thinking, gosh, I wish I didn't hear all of this. Sometimes I go to seminars and we learn so much, but this is I guess the new reality, and we're just going to have to force through it. I recommend anybody that has additional questions, really don't try to maneuver this on your own. Seek out help. Carmen and Armando are available to assist you. This is just too much for someone to try to tackle. The information for both of them is on your screen. Also, we've recorded this whole session. It will be on the Risco Facebook and also on our YouTube channel. So you can feel free to listen to it again or take parts in it. But their information is right there. I would definitely recommend a consultation because it's just so important to make sure that you're set on the guidelines and the new protocols and making sure you're compliant.